Hi guys, what's up? This is Dr Alasa Mohammed. Welcome to our online clinic, and today we'll be talking about activities which couples can engage in order to help them conceive, in order to give them a better chance of conceiving. Now, we have been used to the normal style of a man going in with a woman and have sexual intercourse and she conceives and good. Yeah, that is normal because we have been used to that. Man, woman go into the room, have the sexual intercourse and pregnant. Even some people just want and the woman conceive. Good, it's normal. But there are some persons or some people that need special cases. And when I mean special cases, that means people that have been married for a year or two and they have been doing their normal sexual intercourse, but conceiving or pregnancy is not coming forth. So they have to try other methods. Because in our last video, I said there's only a stupid or a foolish person that will continue doing the same thing over and over again to get a different result. You have been having your normal sexual intercourse and you're not conceiving or a child is not coming forth for a whole year or 2 or 3 years. I've been doing the same thing. Then this time you have to what? Change your idea and change what you do. So first of all, I would start with the first one. According to the child, they said that for a woman to conceive, for a woman to have a better chance of conceive, it's best if she get to climax before the man ejaculates. What I mean by climax is when the woman has gotten satisfaction, because when she has gotten satisfaction, there are some hormones that are being released inside her, and those hormones help to facilitate conceiving. Now the idea is this: it is very difficult, or it's hard for women to get to climax when compared to men, because men, once they're having their sexual intercourse and within 10 minutes they are done, and once they release their sperm, they have gotten to climax. But for women, it's very, very hard. Now for a man and a woman to get to climax at the same time, I always advise for the man to engage in more foreplay before sexual intercourse. It's not the idea of you just coming in and just bouncing on your wife and having a sexual intercourse and God, no. Sometimes the woman body might need some stimulation for her to come to life. Like for man now, once you just have your erection, you are good to go. But for some women, they need to get to some point. They need to attain some level of orgasm before they can get sexual satisfaction. In order to do that, I will always advise couples to at least engage in a lot of foreplay. This foreplay will help to bring the woman's system back to life, make the woman sexually active. So once you are having, after the foreplay, having your sexual intercourse, once you are releasing, the woman is getting to climax, and once the climax are going to a climax and you release, then there's greater chance of her conceiving, as I said earlier, because there are some hormones that are being released after the woman has conceived, getting to climax. The hormones will help facilitate conceiving. That's that on that. So please always engage in more of foreplay. Foreplay, when I mean foreplay, I don't mean a 2 or 3 minute foreplay. I mean a lot of foreplay, at least 30 minutes to an hour foreplay. Yeah, it might be so long, but you need something, you need a result. So you have to try something differently. So now try a lot of foreplay this time. An hour foreplay, okay, then you start your sexual intercourse and you get released, and make sure that your wife get to climax before you just make sure she's almost getting to climax before you start your sexual intercourse. Then once she's at climax, you try to release for her to conceive. And then the next thing, that's a woman that after sexual intercourse and they are getting up from their bed, there's always a flow back of sperm. When I mean flow back, that means the sperm flows out back after sexual intercourse. For some women it happens, yeah, it's normal for some women, but that doesn't stop you from not conceiving. It doesn't stop you, because you're doing sexual intercourse, you have like at least 10 to 15 million of sperms that have been deposited inside you. Even if any content will come out, at most 1 million is out, but you still have like other ones inside. But it doesn't stop you from conceiving. But in such case, I always advise women, if you know you're in that category that's always having sperm flowing after sex, make sure that after sex you still remain on bed for at least 30 minutes, and make sure after your husband have released inside you, try to put a pillow under your waist to lift your pelvic region above a little, so the sperm can flow in more. That will also prevent sperm from coming out, so that will also help you in conceiving. Okay, then the next one our advice is for the men. Also for the men, our advice is to have more sexual intercourse. Yes, for you to conceive, for you to be able to participate in conceiving. That because when for a woman to conceive, it's not only the woman's activity, it's both the man and the woman. So both of them must come together, play the same role. So the man must bring the sperm that the woman should produce her egg for them to conceive. Now for the man, I will engage you. I will advise for what? More sexual intercourse. For example, a man that's having a low sperm count, as I said in my last video, low sperm count doesn't mean that all the sperms are bad. It just mean that some are good and some are bad. But if you engage in more sexual intercourse, you mean to release more sperms, and the more sperms you release, the more chances you have of producing more sperms that are good for them to be able to fertilize the egg. So I will advise the men to try to engage in more sexual intercourse. In my last video again, I talked about don't be conscious about you lasting long. Now be conscious of you able to what, go more rounds for you to be able to produce more sperm, because now the main idea of this is what, conceive, and not for pleasure. If you want to have sexual pleasure, you can do any other thing you want, but this time is for you to want to be able to conceive. So try to engage in more sexual intercourse, so you're able to produce more sperms, so you have a greater chance of conceiving. Now the next one is for what? Deep penetration. For the men, when you are having sexual intercourse with a woman, your wife, try to penetrate deeply. When I mean deeply, I mean try to, when you're trusting in her, try to get a sexual position in which you can always penetrate deeply. You can get any style you want, any style you want, but for me, I would advise the normal missionary style. The missionary style help you to penetrate deeply, and especially during the time of ejaculation, make sure you're in a position that you can always penetrate deeply, so you're able to what, deposit all your sperms in there. Because if you are not penetrating deeply, once you're releasing, there might be some sperms that flow out, and that might reduce your chances of the woman conceiving too. I would advise when you're almost getting to orgasm, if you know you're in a position that you're not penetrating deeply, then try to change your position and try to get to a position that can penetrate deeply for you to be able to put all your sperms inside, for the woman to be able to be able to conceive. The next one is eating balanced diet for the women. Now, most women are used to junks. Sorry for saying that, but it's just true. Because of I want to watch weight, I don't want to eat more food, this, that. Please, I would advise you eat a lot of balanced diet and a lot of fruit. That will help you in conceiving. A lot of fruit like watermelon, cucumber, carrot. That will help you a lot. And eat more food than junks. And again, stay away from. I will advise you to stay away from unwanted drugs. There are some drugs that they are not necessary to take. For instance, you are just having a slight headache. What you need is just to go and rest, but you prefer to take Panadol or paracetamol or something. Those are unnecessary drugs. You only take them when you have gotten to the state that you know, okay, I'm done. I cannot take this pain any longer. Let me just take a pain relief. But if you know you can still take it, just go and rest, sleep, and when you are awake, you are back to normal. Or some women take drugs unnecessarily without knowing their use. Okay, these drugs for slimming. You take a slimming tea drug. You take a boobs fattening drugs, or a bobs fattening drug. Those just if you know you want to conceive, or you are in the process of conceiving, or you want to get a child, stay away from unwanted drugs. Any drugs that will not benefit you, or that doesn't have any importance to you, stay away from them. Especially for women that maybe they take some drugs to prevent pregnancy or stuff like that. That can also alter your cycle. And again, for the last point I'll put in, all women should know how to calculate their ovulation period, because all women have different ovulation period. You always know that it's always 28 days period or normal period, but now some women have lesser than that and some have more than that. So all women should be able to know their kind of period and how to calculate that period to get their ovulation period. Once they get their ovulation period, then that should be done. They should have a lot of sexual intercourse during that time, because they said a woman that is looking for a child doesn't wear pants when to sleep. Yeah, that's a Yoruba adage. I don't know how to speak Yoruba, but they said a woman that is in need of a child doesn't wear pants to sleep. So make sure you're engaging more sexual intercourse. And again, that's what they call ovulation signs. Try to watch your body to know your ovulation signs. Some ovulation signs are pain in your left side of your stomach region. There are some left part, some maybe your breast might be increase in breast size, or nipple pain and stuff like that. There are some ovulation signs you should always watch out. When you get those signs, then you know the next thing to do what get into sexual action. And for your husband, always try to advise them to engage in what more foreplay, so you as a woman can get to climax, and when you can get to climax is for both of you, because once you get to climax you get to conceive, and he becomes a father, he becomes a mother. So try to, all these have highlighted, try to work with them, and I hope by God's grace you get a testimony. And after watching the video, kindly share with your friends and family, like, comment. If you have any questions, comment your questions. I'll try to answer them or make a video on your questions. Then also try to subscribe to our YouTube channel. You can also follow me on Instagram. That's at Dr Alasa. That's Dr Dr_Alasa. Follow me on Instagram. Ask your questions. I will try to give you answers. Thank you very much, and God bless you.